So doctor, do you use any prophylactic or of your own?
No need of a prophylactic. We are being, see, prophylactic, it gives protection for 3 to 6 months. We are continuously exposed to this, and most of the time the good thing is we should have a good ventilated room, and a cross ventilation should be there, and a good sunlight and other things should be there. And somebody who is coughing, and whenever seeing TB patients, you take extra precautions that he doesn't cough in front of you, and have a proper cough etiquette, so that those spread of infection is prevented. So, and other things, as per as prophylactic, it's not required actually. It's spread by airborne infections. We need to protect from this thing. If your immunity, the TB manifestation depends of your immune system more than exposure also. But if your high overload of exposure is there, then you are more susceptible for TB. I use, like, sometimes if you see the active TB, some you suspect the X-ray showing like that they suspected TB, I will be careful whenever I go near to the patients. Wear the mask. N95 is more protective, or simple surgical mask is reasonably bit protection. It's for a mental this thing that we should not go to this thing. And earlier they used to treat the patients in isolation hospital where they are abandoned like untouchables or like that. It's not required there. TB can be treated in the community. Our concern, and internationally everyone, it's the concern of treating the TB patient is not for the patient himself. It's the community at large. We are this, because a patient who is active TB, he can easily spread 8 to 10 people before he really gets into a treatment. So to make him non-infective, he needs isolation, sometimes quarantine and all. So for that reason we need to halt the spread of tuberculosis.